One of the other adjustments that I want to talk about that's often performed by chiropractors, in fact, you could probably say it's a staple in addition to the cervical spine adjusting, is lumbar spine adjusting. And I have a lot of patients, much like the neck, that report that when they've been adjusted previously or by other chiropractors, it was uncomfortable and it was too forceful. And this is one of the stereotypes that I have to break with patients, that it doesn't have to be aggressive. A good setup and a good lockout on that particular adjustment will minimize the force needed. Again, this adjustment, much like the neck or any procedure chiropractically or to the body, needs to have a thorough examination and history done first, which we always do. So one of the common pitfalls that I see when I'm watching YouTube videos myself is excessive rotation of the lumbar spine, much like the neck and the cervical spine adjusting. Now, why is this so important? The biggest reason of the importance of this is the makeup of the lumbar spine disc. The disc runs this way and this way. The annular fibers that hold everything together are running in a 45-degree fashion. So when we put a patient in the side posture position, we're automatically removing 50% of that disc integrity. So if there is an injury to that disc, what we may have is only 25% of the fibers remaining. You see the practitioner push the patient's upper body all the way back and then bring the body all the way through. This is kind of like wringing out a towel. We're creating excessive rotation through the spinal ligaments, which there's numerous spinal ligaments throughout the entire spine, but as well as now we've put that disc in a position of where we can over-rotate it and potentially cause or worsen an existing injury. So how I like to approach this is shoulders flat. So she's completely level with no rotation. A lot of patients that have been to other chiropractors will immediately go into this position, and I'm quick to correct them saying, that's not how we're going to do it. Next, we want to make sure that we have good traction. So we set this up to where then I traction her here. She's in this position. Now, the other thing that you see is it's just a gentle lean in, and that's all you have to do to correct a fixation of the lower lumbar spine vertebrae. You